Dr. Eyal Levit to the podium, who is a master dermatologist, finished a Mohs fellowship, and also has a cosmetic dermatology training, and runs a practice, but also does exceptional things in the practice and tries essentially almost everything new earlier than most other people in the United States. So with that said, again, welcome.
Thank you very much, George. I'm wondering who you're talking about. I should let him come instead. First of all, I want to say, you know, we often don't realize how much work it takes in order to make this amazing meeting and look seamless and learn a lot of stuff. And I just want to say great thank you to the organizers, to George, to everybody who made this happen. I've learned so much. I've enjoyed so much. It truly is an amazing experience. So thank you very much. And you know, a shout out, sometimes you forget. It's kind of like you go to dinner and your wife prepares the dinner and you forget to say how amazing it is because you think it's the usual way how it has to be. So shout out to my wife over there, Elena. Thank you very much for everything. So want to start with a little story. A few years ago, I was taking care of a Hungarian patient, and he looks at me after the end of the treatment with this intense look in his eyes, and he says to me, "Doctor," and I say, "Yes," and he says, "In a few years, you're going to be going to Hungary." I'm like, "Why?" Like, you know, I'm gypsy, I can tell the future. I'm like, okay, whatever, make it happen. You helped me and my patients and my family a lot, so I want to tell you something. When you're going to go over there, you go to this special place, and the answer to your question will be found over there. But anyway, if you guys got a chance to see this amazing St. Stephen's Basilica, this is there, and apparently George got married over there. It's a beautiful place, and as you go there, kind of reminds you a little bit of the idea of the Parthenon. You know, when Socrates went there to Delphi to get the oracle's answer, it says over there as you enter, know thyself. Well, over here, it's different what it says. It says, ego sum via veritas et vita, which means I am the way, the truth, and the life. And I was like, what exactly are they talking about? So anyway, I go inside, like he told me to go inside. I go inside, and inside, I'm looking around for the answer to that, and I see the hand of the first king of Hungary, St. Stephen. And I'm like, you know, the hand is like a fist. You can't really read anything there. It's traveled a lot. And so I asked the hand, what is the really, you know, the purpose of life? And he tells me, well, the purpose of life is to find the way to the truth and to a healthier living. And that is prevention. And that's what he's talking about. He's talking about treatment of advanced field cancerization. This is really our goal. So without further ado, one of the key questions that we'd like to review with you guys today is, why do we care about actinic keratosis? And it's been already talked a little bit about here, and we'll get more into it. What are the current treatment options, and how do I approach it? So let's start at the beginning. Why do we care about treating actinic keratosis? Well, actinic keratosis, you can look at them as the check engine lights. They're telling us about the cumulative amount of UVB exposure and therefore the UVB damage. And if you ignore that, it's kind of like Bart ignoring the lights over here that tell him about the engine. Is like, I know better. Well, you know, the car stops working. So it's important for us to see it as a sign of the amount of UV exposure. But it's not only a sign, but also the number of AKs are a marker of the cumulative carcinogenic exposure. What we know is that about 0.1 to 40% of actinic keratosis can become squamous cells, especially the hyperkeratotic ones. 60% of STC arise from actinic keratosis, and a study that was done, a study that was done in Acta Dermato-Venereologica, a 10-year study, compared about 3,000 patients to 15,000 patients with a control, and found that those who had actinic keratosis had about 8 times higher chance over the 10 years to develop squamous cell, 4 times more to develop basal cells, and even melanoma 3 times more. So indeed, all the mutations that we were shown earlier that are occurring, there are 53 and other mutations, are really signature mutations for UV damage and may lead to the evolution of all those skin cancers. And then the third most important thing is that the arrows decide to go up. It's really important. The more actinic keratosis you have, the more you have skin cancer, but also you have solar elastosis. And we are here at the International Academy of Cosmetic Dermatology, and therefore it's important for us to realize that not only is it important to take care of actinic keratosis because they're a sign of the engine lights, right? The sign that we need to pay attention to the potential increase in skin cancer, but also they're a sign of aging. And then the question goes, well, if we reduce the number of actinic keratosis, can we reverse the risks of skin cancer, and can we also reverse the look? Can we look better? And indeed, as Carmen was showing us in the previous slides beautifully, it does do that. And the way it does that is it's able to reduce the senescent cells that are causing the architecture to become what we see clinically as the dermatoheliosis or the polypodyum of Savant, the hyperpigmentation, telangiectasia, and skin atrophy. Under the microscope, you see it as the bluish discoloration, the thinning of the epidermis, and the dyspigmentation. And so, when we take care of it, our patients will thank us, kind of like the plumbing. You know, I find that the plumbers are more even successful than the dermatologists in terms of the profession. You always call them anytime, and they always are hard to get an appointment with. But it's important, because if you don't, you'll deal with a bigger problem later on. And so the question is, how do we really take care of it? And in order to understand it, we need to look at the pathogenesis of the way that the healthy cell becomes an actinic keratosis. And the problem is that very often we only concentrate on what we see as physicians. Just like George was saying, we're concentrating on this area of treating the actinic keratosis. But what we don't take care of is we don't understand the importance of taking care of the DNA damage. I think if we were able to, just like we're able to see the actinic keratosis damage on our skin, if we're able to see the DNA damage on our skin, we'll be much more apt to treat and get into the healthier cell. It's kind of like telling patients, stop smoking. Well, you know, they don't see the problems that are happening in their lives. They saw some pictures somewhere, but what does it mean to them? So, you know, all the studies that you guys are doing, the basic science studies, are really helping a lot. So thank you very much. And what I want to talk a little bit about as well is, besides all the topical things that we are using, we can use also supplements. And vitamin B3, there was a study that was published in 2015 in the New England Journal of Medicine. It was a study from Australia, showed that if you use nicotinic acid, the vitamin B3 type of analog, 1,000 milligrams per day, you can reduce by about 15% the amount of actinic keratosis that you develop compared to the control group within a year. And also you have about 23% less squamous cell carcinoma. And the reason is that this actually stimulates the production of adenosine triphosphate, the energy necessary to repair the DNA damage. But other things have also been shown to be helpful. One of them is vitamin D, and that's something that actually I was taught by my fellow Lila Parag to look into it, because George told her about that stuff. So applying the calcipotriene ointment, and it's been shown as an amazing adjunct. Either you use it as a high-dose vitamin D, about 10,000 for 5 to 14 days together with photodynamic therapy, or applying it topically. Vitamin A also helps, and they help with the different mutations that we just talked about that occur. So, for example, the Polypodium leucotomos, I call it PD, it's kind of like the police department. It helps the P53, which is the guardian of the universe, kind of like when we're talking about the clones. Thank you so much. So the Polypodium leucotomos, which is a fern extract taken from South America and studied actually in Spain, it's mostly in Honduras, they found that this actually is able to increase by 63% the regulation of P53 in the cells of hairless skin mice. The studies that they did. But vitamin A as well. So vitamin A not only topically, but also orally. And now in South Korea, a lot of them are using it. I have been using it for about 25 years at a low dose, about 10 milligrams once a week. And it's amazing. So I'm told I don't look my 76 years of age. I don't know if you agree with that, but anyway. So to quote Benjamin Franklin, and that's what I want to show you guys, an ounce of prevention is worth a pound of cure. So just putting a little bit of the sunblock is worth a pound of cure. So we should really look at the prevention. And these are some of the treatment options. I'm looking at my time. We have the office treatments. You can do the liquid nitrogen, and you can do lasers, you can do chemical peel for dynamic therapy. The home treatment, which is prescription creams, which can be done any from 2 to 3 days, the Decado, or the 5 days, like was shown by Carmen, the new cream. Or you can do it as for years. And then supplementation we spoke a little bit about, and everybody knows, but we need to know more about the sun protection, whether using the HelioCare, which has the Polypodium leucotomos extract in it. Topically, you can apply it also. That helps with sunscreens right over here. But more effective, I like the sunblock, specifically looking for zinc, titanium, and iron oxide. Iron oxide helps from the blue light for aging as well, and the UVA damage as well, which the regular zinc and titanium don't help as effectively in the UVA range. So what are the office-based treatments? There are a variety of treatments that we can use. We discussed it. I'm not going to go over too long because I don't want to take your time. But this is what my approach is. I like to do liquid nitrogen treatment, and I'd like to not treat. If I personally treated the area, I know that if I sprayed the lesion twice, it didn't go away. Maybe I made a misdiagnosis. And it did happen to me one time. I saw a lady, she came to me with a red spot under her eye, and I said to her, well, this looks like an actinic keratosis. We can spray it. We can do a biopsy. And she's like, why not do a biopsy? And I'm looking at her, wow, you want a biopsy? End up being a melanoma. So, you always want to make sure that you pay attention to that. You never forget those things. And then the second thing that I do is I do photodynamic therapy, and I do it with sandpaper, and I'll show you quickly a video how it works. But what you can see in the first video, if it would work, is that I'm using a sandpaper to remove the hyperkeratotic lesion on the person's scalp. Then I apply the 5-aminolevulinic acid. You can use MLA, methylene levulinic acid instead. And I let it sit for an hour and a half. Some people use heat, that improves it. When I used to do curettage of the lesions, I used to numb the area. The problem when you do numbing is that it prevents the necessary products that would result, the porphyrin that will result and be sensitive to the light, the red light, and therefore it won't work, so you don't want to put anesthesia in the area. So this is the different treatment options that we have, just a few of them. Topical, this is the home-based, what you prescribe them, and what you're seeing in the numbers over here, this is the cure rate. Now, I haven't personally seen it, but then again, few people can tolerate 4 weeks QHS in direct continuity application of that. So I'll show you how I use it personally. And imicomide, they're showing 86% cure rate. But the problem is that it recurs. And that's what we're trying to avoid, so it doesn't come back. Plus, you have a lot of downtime. Anybody who's working, very difficult to go through that. So what my approach is from all those things that are here, I like to use 5-fluorouracil, imicomide, diclofenac, and I supplement with NMN, which was made famous by Dr. David Sinclair from Harvard, PhD, and it's also vitamin B3 type analog. And it's not been studied in humans, really studied more in mice and dogs, and it also significantly helps reduce the amount of damage to the DNA and repair it. It's been used post-treatment for prostate cancer and for other radiations, and showed an effect in those patients. Not preventing the damage from the radiation, but increases the repair of the DNA, and it has less side effect than others supplements. The way I like to use the 5FU, I think that's important, is I like to use it as a litmus test. So I tell the patients only apply it for 1 week. On the second or third day, it starts doing its function, and you can see the area becoming red, and then they come to the office and I spray it with liquid nitrogen, which makes it much more effective. So it breaks the cells a little bit apart, makes them more susceptible to the liquid nitrogen, and then you apply the liquid nitrogen, you know exactly the extent of the actinic keratosis. So instead of just utilizing your eyes or using some expensive machine to figure out how far the actinic keratosis damage extends, the 5-fluorouracil highlights the extent of the area, and then the liquid nitrogen is going to be more effective as opposed to what I often see is hypopigmented center and the recurrence of the actinic keratosis in the edges. So these are some of the supplements that you can use, and the one that has been extensively studied, as I said, is nicotinamide, the vitamin B3. Some of the side effects you can see here on the side, and the dosages. Also, the isotretinoin, I don't use this high dose, as I said, but the moment you stop the isotretinoin, the problem comes back. So this is just an example of a patient of mine who was willing to share his photographs, and you can see we did photodynamic therapy for him. This is after the 2 sessions of photodynamic therapy a year later, and you can see he has other lesions that we biopsied as well. It was a squamous cell carcinoma in situ, and on rebiopsy they showed that they were clear. So you can see some recurrence of the lesions. It's hard to have them stay, but he also takes supplement NMN 1000 per day. What I want to say to you guys is that one of the special things that my wife told me is that caring is sharing, but it's even more important when we are sharing information with one another, what we know through either questions or education, we're actually getting back, and that's what you have with the palindrome over here. So I want to thank you guys for the opportunity to come here, to learn from you guys, learn with you guys, and from one Liberty statue to another. This, if you guys don't know, this is the Liberty statue of Hungary. She's holding a palm leaf, and that's a sign of freedom and peace. And you have here the New York, where I'm from, Statue of Liberty holding the light force is around the corner. 1776, the Declaration of Independence, signing of the Declaration of Independence, and right at her bottom you can see the broken shackles of the slavery that were gone. So thank you very, very much for the opportunity.
Thank you very much.